Welcome to today's lecture on advanced topics in radiology. In this session, we will explore various cutting-edge techniques and applications of computed tomography, CT, imaging. CT imaging has revolutionized the field of radiology by providing detailed cross-sectional images of the human body. With advancements in technology, CT scanners now offer a wide range of capabilities that go beyond basic anatomical imaging. Now, let's delve into the fascinating world of advanced CT imaging techniques and their clinical applications. Dual energy CT is a modern technique that utilizes two different X-ray energy levels to differentiate various materials within the body. By gathering information about tissue composition, dual energy CT imaging can provide enhanced characterization of lesions, improved detection of subtle pathologies, and the ability to differentiate between benign and malignant lesions. Additionally, this technique allows for the characterization of renal stones, identification of gouty arthritis, and evaluation of material composition in the presence of metal implants. Perfusion CT is a valuable tool in assessing tissue vascularity and blood flow. By acquiring a series of rapid CT scans following the injection of a contrast agent, perfusion CT can evaluate tissue perfusion, capillary permeability, and the presence of ischemia. It finds applications in various clinical scenarios, including the assessment of acute strokes, evaluation of solid organ tumors, and detection of pulmonary embolism. Perfusion CT aids in treatment decision-making by providing crucial information about blood flow alterations within tissues. Cardiac CT angiography has emerged as a non-invasive imaging modality for assessing coronary artery disease. By utilizing specialized techniques such as perspective gating and high spatial resolution imaging, cardiac CT angiography can visualize the coronary arteries and accurately evaluate the presence of significant stenosis or calcifications. This technique is particularly useful in patients with low to intermediate risk for coronary artery disease and can assist in the selection of appropriate management strategies. Virtual colonoscopy, also known as CT colonography, is a minimally invasive alternative to conventional colonoscopy for the evaluation of colorectal polyps and tumors. This technique involves the acquisition of high-resolution CT images of the colon and subsequent analysis using dedicated software. CT colonography offers advantages such as reduced invasiveness, shorter examination time, and the ability to detect extracolonic findings. It plays a crucial role in colorectal cancer screening, monitoring, and surveillance. Interventional CT is a precise technique that targets and treats lesions in the body. It involves CT-guided biopsies, which help diagnose malignancies, and CT-guided ablations, which destroy tumors with minimal invasiveness. These procedures are safe and can be done with local anesthesia or sedation. Functional CT imaging techniques provide valuable physiological information by measuring tissue perfusion and ventilation. CT perfusion evaluates blood flow and tissue perfusion in various organs, such as the brain and liver, aiding in the diagnosis and management of stroke, tumors, and liver pathologies. CT ventilation, on the other hand, assesses lung function by measuring the distribution of inhaled air and ventilation patterns. These functional CT techniques enhance our understanding of organ physiology and assist in disease assessment. Advancements in CT technology have led to the development of sophisticated image post-processing and visualization tools. These techniques allow radiologists to manipulate acquired CT images, enhance anatomical details, and extract additional information for precise diagnosis. Examples of advanced post-processing techniques include multiplanar reconstructions, maximum intensity projections, 3D volume rendering, and computer-aided detection. These tools empower radiologists to uncover subtle abnormalities and improve diagnostic accuracy. CT imaging plays a pivotal role in the evaluation and management of acute stroke patients. Rapid imaging acquisition, such as non-contrast CT and CT angiography, allows for the identification of early signs of ischemic stroke, assessment of vessel patency, and determination of the presence of intracranial hemorrhage. CT imaging aids in triaging patients for time-sensitive interventions, such as thrombolysis or endovascular clot retrieval, leading to better outcomes for stroke patients. Spectral CT is an emerging technology that offers additional information beyond conventional CT imaging. By utilizing two different X-ray energy levels, spectral CT can differentiate materials with similar densities, characterize the composition of kidney stones, and detect gouty tophi. Additionally, spectral CT enables the quantification of iodine uptake, thereby enhancing the evaluation of tumors, renal function, and perfusion studies. The clinical utility of spectral CT is expanding, and further research is being conducted to explore its full potential. Despite technological advancements, artifacts can still occur in CT imaging and impact image quality. Common sources of artifacts include patient motion, metal implants, beam hardening, and reconstruction algorithms. Radiologists must recognize and understand these artifacts to avoid misinterpretation. Various strategies, such as patient immobilization techniques, advanced hardware, and artifact reduction algorithms, can help mitigate these artifacts and improve overall image quality. CT imaging has transformed the evaluation of trauma patients by providing rapid and comprehensive assessment of injuries. Multi-trauma CT protocols offer a systematic approach to evaluate multiple body regions and identify life-threatening injuries. This technique aids in the detection of fractures, organ injuries, vascular injuries, and pneumothorax. CT imaging plays a crucial role in trauma triage, treatment planning, and monitoring response to interventions, ultimately improving patient outcomes. PET-CT fusion imaging combines the metabolic information obtained from positron emission tomography, PET, with the anatomical details provided by CT imaging. This technique allows for the precise localization and characterization of malignant lesions, assessment of treatment response, and detection of distant metastases in oncological patients. PET-CT fusion imaging aids in staging, restaging, and treatment planning in various malignancies, such as lung cancer, lymphomas, and colorectal cancer. In conclusion, CT imaging has revolutionized radiology, offering valuable anatomical and functional information. Techniques like dual-energy CT, perfusion CT, cardiac CT angiography, virtual colonoscopy, and intervention CT provide advanced diagnostic capabilities. Additionally, functional imaging and post-processing techniques provide insights into organ physiology. Understanding artifacts and implementing strategies for artifact reduction is vital for accurate CT interpretations. Finally, kinetic imaging greatly enhances trauma assessment and oncology, improving patient care and outcomes. Thank you for attending today's lecture on advanced radiology topics.